You primarily gleaned from the numbers. Is this a case of more testing? Is it clearly spreading in these states? If so, how badly? Should we worry about the healthcare system being overwhelmed at this point or not?
Well, I think we're seeing a couple things. We're clearly seeing more testing. The U.S. is doing about 500,000 tests a day, and that as you do more testing, you're going to find more cases. But also because we have relaxed restrictions, there is more people out, and there is going to be more transmission. And I think what we need to realize is that the virus has not gone, that we have decided to go ahead and open the economy and open things for very clear reasons, but the virus has not gone. So therefore, we have to continue practicing safe distance. We have to continue wearing masks, and we have to continue face masks, and we have to continue washing our hands. We need to be as careful as possible, because the one thing you don't want to do is you don't want to get infected. The one thing you want to do is you don't want to get sick. The U.S. is, as you show in that graph, pretty much in a plateau of about 20,000 new cases per day. But that graph of the U.S. is a combination of states like New York, where the cases have really gone down significantly, and states like California, Texas, Florida, North Carolina, with the cases are really going up.
Right.
So when you look at that plateau, you're really seeing a mix of different things together.
What kind of reaction, and this is important for investors to think about, obviously, what kind of response do you expect? Do you think any of these states where there are more cases are going to adopt more shutdown measures? Do you think shutdowns are completely off the table? Do you think that mask wearing and other kinds of preventative measures is going to be sufficient?
You know, if everybody wore a mask, if everybody wore a mask in public, if everybody did the right things, if we didn't go to events of more than 25 to 50 individuals, if we kept safe distance, if we kept hand hygiene, I think that will be sufficient. I think adapting, lockdowns again, it's a little bit like trying to put, toothpaste back in the tube. It's going to be really hard. And I think the economic pain has been very significantly.
Mm-hmm.
So I think we really need to think about how do we prevent. We are going to see cases. We got to prevent outbreaks. We have to prevent cases spreading to the point of outbreaks. And we have to decrease cases among the most vulnerable who result in hospitalizations and death. That is going to be the key function of public health.
Do you think people are more knowledgeable about protecting those in nursing homes, the vulnerable population self-isolating to some degree? And I want to ask a sort of unrelated question, and it's actually about the NBA and their bubble strategy to play games this summer, which some of the players are becoming more concerned about. Here in New York, they've said no sleepaway camps. You can only do day camps. Any scenario in which people are kind of gathering in one place for a period of time seems to be seen as dangerous. And isn't that exactly what the NBA's plan is in Orlando?
Well, as long as they can keep people in a bubble together, I think it's going to be okay. But of course, you know how difficult that is. I mean, what we clearly have learned in this virus is being outside is better than being inside. Being in crowded places is worse than being in non-crowded places. And I think you have to stay, there's a very nice description of an outbreak from a calling center in South Korea that pretty much everybody in that section got infected on that floor. But it didn't infect other floors. So it wasn't so much the elevator as it was the closest of being in one place. So I think we're learning a lot about this virus transmission. We have to remember at the end of the day, it's a virus. It's not a monster. We know how it's transmitted. We know how to prevent it. And I think if we did the right things as population, we could clearly slow transmission significantly. The problem is most of us have said, I've had enough with this virus. And the virus hasn't been told that. We have to remember that the virus is still around. It's highly transmissible and could produce a lot of disease and death in the coming months.